And until you deplete your glycogen first, you can't burn your fat. So what I try to do is get them to change their dietary intake and do time restricted nutrition to start beating their glycogen reserves down. And then that will put them into ketosis. But you don't go into ketosis until you get rid of your glycogen reserve. And that's what it takes, about 3 days for most people. And so that's the critical element. Once you're, and so realize also ketosis is a measure of how is your insulin, because if you're producing insulin, you cannot, you won't go into ketosis until you reduce your insulin production. And so those are the kind of metrics that we look at. So first thing is vegetable oil, because we want to change the fluidity of their membranes. And you'll see an effect at about 12 to 18 weeks. We want to change their carbohydrate intake. You can see that effect in 3 to 5 days. You can see their glycogen reserves coming down. You can get them into ketosis. Ketosis itself allows you pain relief. And at the same time, and if you get into sufficient ketosis, there's certain pathologies that are epileptogenic, that are seizure oriented, such as migraine headaches. It can eliminate those. So there's all kinds of little nuances to that. Depending on the kind of person it is, we may be putting them into an infrared sauna. We may be putting them into a heated sauna. We try to do all of the things that we can to improve their metabolism and increase their joint health and the amount of fluid around their joint, the healthy fluid. And then we get them into exercise later. The simple exercise is just walking. And I encourage patients to walk after every meal as best as they can. If they're watching TV, they're to constantly be in motion. I want to get rid of their sedentary activity. Right now, the average American spends 9 hours a day in sedentary activity. That's outside of sleep. And some patients, that's average. Some patients are spending 17 hours in sedentary activity. Those happen to be my patients. So we try to fix that. And then we also fix gut microbiome. We go through there and try to deal with their anxiety and fix their gut microbiome. We go through there and give them sleep hygiene, dark, cold room with a fan, and no blue light for 2 to 4 hours before bed, no caffeine for 6 hours before bed. And we kind of have a protocol that we march through sequentially.